I love my children, and I will do anything to protect them. So that's why, as a mom and as a doctor, I made sure that my daughter got the HPV vaccine to protect her from cervical cancer later in life when she becomes a woman. The HPV vaccine is very safe and effective.
I was afraid of the injection at first, but I got it and it really wasn't that bad after all.
If there was something you could do to protect your child, wouldn't you do it? Protect our next generation. Ensure that your daughter gets the HPV vaccine today.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Protect yourself from the bite of this mosquito.
A message from the Ministry of Health and Wellness.
Mosquitoes carry dengue, but you can protect your family. Step 1. Use mosquito nets, especially at nights. Step 2. Install mesh on doors and windows to keep mosquitoes out. Step 3. Apply mosquito repellent to exposed skin. Stay safe. Stay protected. Prevent dengue today. A message from the Ministry of Health and Wellness and PAHO.
Do you recognize the signs of dengue? Look out for these symptoms: high fever, severe headaches, joint and muscle pain, skin rash, nausea, and pain behind the eyes. If you experience these symptoms, rest, stay hydrated, and take paracetamol for pain relief. If symptoms persist beyond 3 days or worsen, such as persistent vomiting, severe abdominal pain, or difficulty breathing, seek medical attention immediately. Early treatment can save lives. Know the signs, act fast, together we can beat dengue. This message is brought to you by the Ministry of Health and Wellness and PAHO.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
%, and more that good for you. You feel so check the nutrition facts. You feel so check the nutrition.
Ministry of Health and Wellness, Jamaica Moves, the Heart Foundation of Jamaica, the National Health Fund, and Japan.
Me? I go show them my way of justice.
I'm abused.
I need legal advice. I don't deserve this.
The truth of the matter is, justice there for all of it. The Ministry of Justice has trained more than 5,600 persons in restorative justice practices. More than 200,000 victims have been supported by the victim services. Legal aid has reached thousands island-wide. Make we talk it out, not fight it out. Call 888 Justice.
Motorists, as Minister of Justice, I appeal to you. Obey the road code, pay your ticket on time, and only go to court if the ticket is being contested. Close to 80% of matters coming to the parish courts are for traffic breaches. Let's work together to make our roads safe and ease the burden on our courts.
Every year, the Jamaican Parliament approves billions of our taxes to be spent on goods and services provided by the private sector. Everything from pens to power plants, cleaning services to construction are obtained through a process called public procurement. But who funds this process? Citizens do. And we want our taxes to be spent wisely. When we talk about public procurement, there's a critical concept called value for money. We hear it in the Parliament all the time, but what does it really mean? Some think value for money means choosing the cheapest option, but it's more than that. For example, a community needs a new bridge, and the government receives bids from 3 companies. Company A offers to build it for $10 million in 18 months with a 50-year lifespan. Company B wants $12 million to finish in 12 months with a 75-year lifespan. Company C asks for $8 million, needs 24 months with a 25-year lifespan. Company B actually offers the best for money. To determine that, we look for 4 crucial factors: economy, efficiency, effectiveness, and equity. Let's explore what each means. For economy, we must look beyond the upfront price and consider the full lifetime costs to maintain the bridge. Cheaper options could lead to frequent and expensive repairs. We get efficiency if the bridge is built within budget and on time, with no waste of materials. To achieve this, we need the best team, and clear criteria helps the government to pick the best proposal. Effectiveness looks at whether the government achieves its goal. This could require a community needs assessment to ensure the bridge will reduce transport costs and travel time, withstand the annual flooding with little disturbance to plant and animal life. Finally, equity. This is about fairness, satisfying the different needs of the community. The bridge design considers not just cars and pedestrians, but is sensitive to the needs of the elderly, disabled community, and children. So when we're talking about value for money, don't just ask how much it did cost. Ask, what are we truly getting for our money? The cheapest option today can become the most expensive mistake tomorrow. So from now on, let's ask the right questions for Jamaica land we love, Jamaica land we own, and Jamaica land we run well.
Na, 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 na. We want a peace for Jamaica. Yeah, yeah. We have to be our brother's keeper. Yeah, yeah. Jamaica live good, yeah. I make we enjoy life. What we feel safe at night. Jamaica live good. I better you and I. No say we future bright. Jamaica live good. Come together as one. I make the violence the world.
Once upon a time in a Caribbean island known for its rich culture, natural beauty, lived a group of people who were buried in piles and piles and more piles of paper. Papers spanning back to the start of time. Then came a bright idea, harnessing technology to work smarter and not harder. The government of Jamaica is improving its operations to serve citizens better. Many services are now available online, and there's more to come. The government of Jamaica, building a better public sector for all.
Are you an entrepreneur producing an excellent Jamaican product or service? Did you know you can earn hard currency and more significant returns by exporting? Contact the Ministry of Industry, Investment and Commerce to help propel your business along the export lane.
Everything you can produce, the Jamaicans overseas want it. We're not going to get rich by just bringing down the debt. We're going to get rich by exporting a lot more. So grow exports, create job opportunities, drive economic growth through exports to make Jamaica a richer and much more prosperous country.
Do your part to prevent mosquito breeding. Mosquitoes will breed in any container that holds water.
Tightly cover water storage containers such as drums, barrels, buckets and tanks. If this cannot be done, pour cooking oil on the water surface. Punch holes in all tins, plastics and beverage boxes to prevent the collection of water before disposal. Cover all tires or fill with dirt to prevent water collection. Scrub all vases once per week to remove mosquito eggs. Use mosquito repellents to protect yourself from mosquito bites. Dispose of garbage properly by placing in plastic bags and securing properly to prevent water collection.
A message from the Ministry of Health and Wellness.
Dengue is ordinarily a mild disease. Persons may get a fever, headache, joint and muscle pains. The illness is often resolved through rest and adequate hydration along with paracetamol to treat the accompanying fever. However, on occasions the illness can progress to severe dengue, which can result in organ failure, bleeding and severe fluid depletion that can lead to shock and even death. Therefore, it is important for persons who are experiencing fever, vomiting, severe abdominal pain, bleeding under the skin, feeling very weak, or getting confused to seek immediate attention. Let us work together to protect ourselves against dengue.
Recognize the signs of dengue? Look out for these symptoms: high fever, severe headaches, joint and muscle pain, skin rash, nausea, and pain behind the eyes. If you experience these symptoms, rest, stay hydrated, and take paracetamol for pain relief. If symptoms persist beyond 3 days or worsen, such as persistent vomiting, severe abdominal pain, or difficulty breathing, seek medical attention immediately. Early treatment can save lives. Know the signs, act fast, together we can beat dengue. This message is brought to you by the Ministry of Health and Wellness and MOHW.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Did you know? Mosquitoes that spread dengue thrive in your surroundings, but you can stop them. Step 1. Empty and turn down containers to stop water collection. Step 2. Cover all water storage drums and containers tightly. Step 3. Fill tires with sand to recycle and remove standing water. Together, we can eliminate mosquito breeding sites. Search and destroy at least once per week. A message from the Ministry of Health and Wellness and MOHW.
I was first diagnosed with cervical cancer at age 33. The treatment was not pretty. It was terrible. I couldn't go to work. and I spent the whole 5 years out of work. The pain, the struggle, I removed my womb. I thought, I'm finished with cancer. 2016, cancer come back. There's hope for your daughter. My experience don't have to be her experience. So mothers, give their children the vaccine. It will be good for your sake and for the children's sake.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Dengue is ordinarily a mild disease. Persons may get a fever, headache, joint and muscle pains. The illness is often resolved through rest and adequate hydration along with paracetamol to treat the accompanying fever. However, on occasions, the illness can progress to severe dengue, which can result in organ failure, bleeding, and severe fluid depletion that can lead to shock and even death. Therefore, it is important for persons who are experiencing fever, vomiting, severe abdominal pain, bleeding under the skin, feeling very weak, or getting confused to seek immediate attention. Let us work together to protect ourselves against dengue.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Protect yourself from the bite of this mosquito.
A message from the Ministry of Health and Wellness.
Mosquitoes carry dengue, but you can protect your family. Step 1. Use mosquito nets, especially at nights. Step 2. Install mesh on doors and windows to keep mosquitoes out. Step 3. Apply mosquito repellent to exposed skin. Stay safe. Stay protected. Prevent dengue today. A message from the Ministry of Health and Wellness and PAHO.
Do you recognize the signs of dengue? Look out for these symptoms: high fever, severe headaches, joint and muscle pain, skin rash, nausea, and pain behind the eyes. If you experience these symptoms, rest, stay hydrated, take paracetamol for pain relief. If symptoms persist beyond 3 days or worsen, such as persistent vomiting, severe abdominal pain, or difficulty breathing, seek medical attention immediately. Early treatment can save lives. Know the signs, act fast, together we can beat dengue. This message is brought to you by the Ministry of Health and Wellness and PAHO.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Did you know? Mosquitoes that spread dengue thrive in your surroundings, but you can stop them. Step 1. Empty and turn down containers to stop water collection. Step 2. Cover all water storage drums and containers tightly. Step 3. Fill tires with sand to recycle and remove standing water. Together, We can eliminate mosquito breeding sites. Search and destroy at least once per week. A message from the Ministry of Health and Wellness and MOHW.
I was first diagnosed with.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Jamaica Eye is part of an island-wide network of camera surveillance systems designed to increase the safety of you, our citizens. If you have a camera system outside your home or office facing a public space, log on to jamaicaeye.gov.jm today. Jamaica Eye, we're all connected. The Ministry of National Security, creating a safer and prosperous Jamaica.
Hey, just a reminder, your mental health is just as important as your physical health. If you're feeling overwhelmed, try talking to a trusted friend or family member. You don't have to go through it alone.
Me, I gotta show them my way of justice.
I'm abused.
I need legal advice. I don't deserve this.
The truth of the matter is, justice there for all of we. The Ministry of Justice has trained more than 5,600 persons in restorative justice practices. More than 200,000 victims have been supported by the victim services. Legal aid has reached thousands island-wide. Make we talk it out, not fight it out. Call 888 Justice today.
Motorists, as Minister of Justice, I appeal to you, obey the road code. Pay your ticket on time and only go to court if the ticket is being contested. Close to 80% of matters coming to the parish courts are for traffic breaches. Let's work together to make our roads safe and ease the burden on our courts.
Today, we can report 2 consecutive years of reduction in major crimes and murders, with a significant reduction of almost 20% in murders for 2024.
Between January 2022 and January 2025, we have reduced murders by 51%. And January 2025 had the lowest monthly murder count since September 2014.
Our efforts have also resulted in the reduction of active gangs by 50%. We continue to increase firearm seizures, and in more communities, we are experiencing less violence. We will realize our vision of Jamaica as the place of choice to live, work, do business, raise families, and retire in peace and prosperity.
The proceeding was brought to you by the Office of the Prime Minister.
A new story is being written for all Jamaicans. The Ministry of Economic Growth and Job Creation is on a mission to transform lives. From increasing access to potable water, to providing secure homes for the most vulnerable, and helping you own a piece of the rock. We're revitalizing communities and preserving our environment. We're making an impact. See the difference. Feel the difference. Building a better Jamaica for you and me.
You can feel it, JC.
Tell me something. How much time you ever hear the government announce a project and wonder why they must spend millions on this and not on that? Well, if you think there's nothing you can do about how your money is spent, think again. Jamaica's budget is more than just numbers. It reveals our biggest problems and goals, our plans to fix them, and what to prioritize. We can even call it a promise book of what will be done to improve our lives. Now, let's talk about the 4 stages of the budget cycle so we can understand how it works and get involved. Stage 1, planning and review. The Ministry of Finance sends out a budget call to every ministry, which outlines the priorities and constraints to guide how those ministries prepare their budget. After ministries submit their drafts, the Finance Ministry reviews, compiles, and sends them to Cabinet for review and approval. Stage 2, parliamentary debate and approval. The Finance Minister tables all budget documents in the House of Representatives. The Standing Finance Committee, which is all 63 MPs, sits to examine the budget documents, and each minister presents their budget and answers concerns the committee has. The committee's report is then tabled in the House, followed by the estimated expenditure, which is tabled as legislation, called the Appropriations Bill. That's right, the budget of Jamaica is law. The budget debate formally opens. We have presentations from the Minister of Finance, the Prime Minister, Opposition Leader, and the Shadow Finance Minister. After their presentations, our MPs vote for or against approval. Like all legislation, it goes to the Senate for their approval and then to the Governor General for his royal assent. No later than March 31st, end of the financial year. Stage 3, implementation. The new financial year begins and approved budgets are sent to ministries. Collecting taxes, borrowing loans, and receiving grants begin. And so does the spending. Stage 4, budget oversight. Now, this is where citizens don't need permission to get involved. Throughout the year, operations and spending are assessed by internal auditors and the Auditor General's department that makes sure public entities are compliant with laws and that their financial reports are accurate. All Auditor General reports are submitted to our Parliament's Public Accounts Committee for review and cross-examination of public officials. The Ministry of Finance, Integrity Commission, and MOHW also monitor government spending to guard against poor financial management and corruption. It is our job to review these reports, check the findings in the newspaper, and look up if breaches are fixed at jampja.org. If not, ask your MP what he or she has done to ensure public officials are held to account. No more 9-day wonders. So, did the government follow through on their spending and investment promises last year? What promises will next year's budget have? How will they affect you? And how can you ensure that you get what is promised? For access to the national budget, check out JAMP's easy digital version and contact info for your MP at jampja.org. Then link your MP and see what progress is being made throughout the entire budget cycle. Support JAMP. Let's do our job to make Jamaica land we love, Jamaica land we own, and Jamaica land we run well. A message from the Jamaica Accountability Meter Portal, funded by the European Union in partnership with the Private Sector Organization of Jamaica.
Zoom in on the nutrition facts. It there in the table on the side or the back. You fi check out the servings, just do the maths. Not taking too much, finger below the facts. Zoom in on the nutrition facts. It there in the table on the side or the back. Take note of the sodium, the sugars and the fats. 5% or less in the on the right track. You fi zoom in on the nutrition facts. It there in the table on the side or the back. Vitamins, minerals and vitamin 2, 20% and more that good for you. You fi zoom in. Check the nutrition facts. You fi zoom in. Check the nutrition facts. You fi zoom in. Check the nutrition facts. Less sugar, less salt intake and less fat. You fi zoom in.
A message from the Ministry of Health and Wellness, Jamaica Moves, the Heart Foundation of Jamaica, the National Health Fund, and JAP.
Today, we can report 2 consecutive years of reduction in major crimes and murders, with a significant reduction of almost 20% in murders for 2024. Between January 2022 and January 2025, we have reduced murders by 51%, and January 2025 had the lowest monthly murder count since September 2014. Our efforts have also resulted in the reduction of active gangs by 50%. We continue to increase firearm seizures, and in more communities, we are experiencing less violence. We will realize our vision of Jamaica as the place of choice to live, work, do business, raise families, and retire in peace and prosperity.
The proceeding was brought to you by the Office of the Prime Minister.
Me, I go show them my way of justice.
I'm abused.
I need legal advice. I don't deserve this.
The truth of the matter is, justice there for all of we. The Ministry of Justice has trained more than 5,600 persons in restorative justice practices. More than 200,000 victims have been supported by the victim services. Legal aid thousands island-wide. Make we talk it out, not fight it out. Call 888 Justice today.
Motorists, as Minister of Justice, I appeal to you, obey the road code, pay your ticket on time, and only go to court if the ticket is being contested. Close to 80% of matters coming to the parish courts are for traffic breaches. Let's work together to make our roads safe and ease the burden on our courts.
Let's
Good morning, ladies and gentlemen, members of the media. Welcome to the Ministry of Health and Wellness's press conference for Thursday, November 27, 2025. We apologize for the late start. This morning, we are giving you an update on the health sector and service delivery post-hurricane. The Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, is joined by Mr. Errol Green, Permanent Secretary, Mr. Dunstan Bryan, Permanent Secretary Special Assignment, Dr. Jacqueline Biseso McKenzie, Chief Medical Officer, Mr. Ian Stein, our PAHO WHO Country Representative for Jamaica, Cayman Islands and Bermuda, Dr. Karen Webster Carr, our National Epidemiologist, Mrs. Paulette Spencer Smith, our Executive Director from the National Council on Drug Abuse, Dr. Nicole Dawkins Wright, our Director of Emergency Disaster Management and Special Services, Dr. Simone Spence, our Director of Health Promotion and Protection, and other members of the technical team who are here. So thank you for joining us, and at this time I'll hand to the Minister for his presentation.
Thank you very much. My apologies to those in the room and those who are listening for the late start. Let me just welcome all who are here. So in public health, we are very determined and have been working diligently to emerge stronger and more resilient coming on the heels of Hurricane Melissa. The health team are here to give an update, and they represent all health workers, 20,000+ across the country, represented by various units, including the Regional Health Authority. And I must say that we have been working as a team, supported, of course, by our partners, led by the Pan American Health Organization, who is represented here by Ian Stein. In terms of vector, water, and foodborne diseases, the ministry continues to intensify the work and the key health messages across the country and enhance community-focused interventions to give priority not only to prevention but also to surveillance and quick comprehensive response in areas hardest hit by the hurricane. I want to begin with vector control. We have identified the high-risk communities for vector control. These communities are being targeted for increased fogging, larvicidal and adulticidal activities to reduce mosquito population and mitigate against the risk of dengue and other mosquito-borne diseases. Currently, some 950 vector control workers are deployed by the ministry, 344 temporary workers, and 606 permanent workers. The ministry also provided the most affected parishes with equipment and machinery to bolster the response. So these include some 13 thermal foggers, 8 ULV machines, 15 drums of insecticides, 70 boxes of larvicides, and also spray pumps. So just an example of the deployment, the equipment, and some additional support to the effort at vector control. The target for November was to visit and conduct larvicidal and fogging in some 500 communities. As of November 2025, some 907 communities have been visited and received larvicidal treatment, which includes treatment of groundwater and container habitats. Of that 907, some 68% of these are from those identified as high-risk communities. Additionally, some 365 communities have been fogged, representing some 73% of the total number of communities targeted for the period. The fogging efforts have been affected by ongoing rainfall and the lack of electricity in some of the areas, but as electricity is restored, it is making it easier for us to access these areas. We have received some reports about vector workers being attacked by residents who are in one way or the other offended either by the fumigation or by their presence We just want to use the opportunity to urge members that the vector workers are acting in your interests, in the community's interests, in your health and safety interests, and we encourage you to please have a conversation if you feel uncertain about something, and we can find a way to work together for the benefit of the best health of the community. They should have their identification, so that should not be an issue. And if you don't see it, you can ask for it. But please work with the vector workers. It's also illegal to do anything that would harm them, and therefore that is something one should be mindful of. More than 3,000 drum covers have been distributed since the start of the response. 5,000 are being procured by UNICEF, 1,500 others to be received from Food for the Poor, and Food for the Poor has already donated some 1,000 covers. The ministry has also distributed 1,000 mosquito repellents in affected parishes. So we have targeted the areas that are most at risk and are doing very specific interventions as outlined on your screen and in this narrative that I'm speaking to. In terms of water, 371 boxes of aqua tablet chlorine tablets were received from UNICEF and distributed and has begun across different health regions. And that's the tablets that purifies the water. And as you know, waterborne disease is a big issue. Some 6,500 chlorine residual assessment at NWC and municipal corporation water supplies and distribution systems, 55% showing satisfactory levels of chlorination, and we are working with those agencies as part of the multi-agency approach to ensure that water coming through the pipes are drinkable and clearly protecting the health of the population. Public health inspectors are conducting community demonstrations on safe household chlorination using these supplies, and our public health inspectors are out in the field. In terms of we recently announced the arrival of the ship called MV Dawn, equipped with a water treatment plant and lab capacity, deployed to the western region, providing microbiological testing support to assess portable water quality in coastal and hard-to-reach communities. The ship departed on November 19th, but the Great River and Logwood water supplies are back in operation, working with NWC, and they have provided us with the information, serving areas previously supplied by the ship. So it's an indication that we're gradually restoring normality. Residual chlorine testing and bacteriological monitoring are being intensified in high-risk parishes to ensure water safety. In terms of excreta, local health departments continue to assess the excreta or toilet facilities, primarily within affected communities. These facilities include sewage treatment plants, water closets, pit latrines, and communal facilities. Special attention is being paid to communities impacted by flooding, resulted in damage to excreta disposal systems. So in the two most affected regions, there are some 142 sewage treatment plants, 93 or 65% of which are operational. And we, again, continue to work with the relevant authorities to ensure that these facilities are functional, and to the extent that they may not be, that they are not a source of contamination in any way to the population, protecting those communities where they're located or where they service. I want to just indicate that in terms of this area of water-borne and foodborne illnesses and vector-related risks, that we have been managing the leptospirosis outbreak declared last week. Our epidemiologist is here and she can comment more on this. But I want to just indicate that our discussion or narrative around this particular issue is intended to provide the necessary advisory to protect Jamaicans and to heighten the levels of alertness. We are mindful that that can easily be understood as panic, and we would like to discourage that. And sometimes the headlines does project a sense of the need to panic. This is not what our intentions are. We're also mindful that we are a country that has an obligation to both the local population, but also, importantly, in a big tourism space, we also have an obligation to our visiting visitors and tourism interests. Just want to say that we are working very closely with the tourism sector. We have discerned no great risk in terms of the facilities that cater to tourists, whether it's the hotels, which themselves are doing some rehabilitation as we speak because of the impact of the hurricane. And we work closely with them, as well as the certified attractions that cater to tours and visitors. We work closely with those entities too. And there is a certification process that is required and that is given in conjunction with health. And so, we are not giving an advisory to discourage tourism or visitors. We are just placing all on alert and are particularly focused on the vulnerable communities. Those communities, of course, we have identified and where we are collaborating in terms of our operations, NSWMA and others, as part of the cleanup of solid waste and, of course, treating with water to avoid or minimize the risk of waterborne diseases, including leptospirosis. So I just want to make that clear, and we will continue to work with the relevant stakeholders, including the tourism interests, to ensure that visitors are safe when they visit our shores. In terms of pharmaceuticals, the mobile units of the National Health Fund, an agency of the Ministry of Health and Wellness, has processed some 3,000 prescriptions across 60 hard-to-reach communities in the West since November 1. And these efforts are ongoing. So the National Health Fund has been out there, and some 3,000 prescriptions have been served. Today, Thursday, November 24th, the mobile service will be in Cambridge, in St. James, Bluefields, Westmoreland, and Prospect and Magotty in St. Elizabeth. Island-wide, drug-serve pharmacy operations continue at 90% of facilities which were not impacted by the storm. Up to Monday, November 24th, the number of prescriptions processed was up to 196,000. And so the NHF is out there. They're providing their regular services, and where they are hampered by the impact of the storm, mobile units are dispatched in communities to serve the population. I want to turn quickly to hospital status. Black River Hospital in St. Elizabeth is being supported by a field hospital that was announced earlier by the NGO Samaritan's Purse in conjunction with the staff at the facility. The facility is a Tier 2 field hospital established on the grounds of the Black River High School. One operating suite and the ability to perform emergency general and orthopedic surgery. 13 patient beds allowing for inpatient hospitalization for up to 7 days, which is the average stay for patients. A functional emergency unit with the capacity for resuscitation and stabilization of critical injured patients before potential transfer to high-level facilities. And essential diagnostic units are also included, such as X-ray machine, basic lab services, often with blood transfusion capacity. It also provides outpatient care, doing up to 40 consultations each day, and this together with the support of services to ensure self-sufficiency in remote or austere environments, difficult environments. The field hospital in Black River integrates full logistical support units, including generators and reliable electricity supply, water treatment and sanitary facilities, kitchen, catering services, and stabilization equipment for instruments. And these are also there's also communication system and wastewater management procedures. So up to November 18th, the facility has provided services to 1,271 persons. Of that total, 70 persons were admitted into care within the facility, and the facility is operating very well and really serving an important purpose while we seek to manage the restoration of the Black River Hospital. I want to just commend the partnership between Samaritan's Purse and the local team on the ground, because they have been really delivering on the need for this very important service. Sablamar Hospital, a Tier 2 field hospital supported by the government of Barbados, is being installed at the Sablamar Hospital as we speak. I will be in that area tomorrow, and we're hoping that by this weekend we should commission the operation of that facility. That facility should carry similar arrangements as Black River, maybe with some differences, but it is a full-fledged field hospital, and it's being supported by some personnel from Barbados, as well as our local personnel, and will fill any void that has been created by the impact of the hurricane on Black River Hospital. And that's a major development. That represents 2 of 3 field hospitals that we have been able to deploy to ensure continued and high quality service with the help of our partners. We also have at Sablamar, outpatient facility that has been set up in the form of health centers, Tier 1, and that is also treating outpatients, and that is going well. Tomorrow I'll get a report on that. And so for Sablamar, which is one of the very difficult parishes in terms of the hurricane, we have been able to respond in terms of hospital services, and will continue so to do as we build out back the Sablamar Hospital. More will be said on that tomorrow when I visit. Falmouth Hospital continues treatment and care of patients. 150 patients seen in A&E. This is their field hospital now. Between October 29th and November 19th, Tier 2 field hospital has been established on the grounds of the facility with the support of the Spanish government, and the facility is commissioned on November 6th and started offering services on the 12th. And since that time has served some 284 patients. So Falmouth is also seeing some positive developments in terms of this field hospital, and I thank again the Spanish government and their team who are here and have been here. I think they have done one changeover, one set has gone home, another here, and they're working with the local team at Falmouth. And in Noel Homes, that hospital continues to provide services to the community. Some 933 patients seen in the A&E since the passage of the hurricane up to November 25th. And there are some developments at Noel Homes in terms of a Tier 1 facility. I will visit there tomorrow, and the staff is working with the NGOs that are there, and we are able to service our patients. Cornwall Regional Hospital has returned most of its services to basic operation, with more than 550 patients with kidney issues being dialyzed, 263 patients receiving radiotherapy, that's cancer treatment, and a Tier 1 field hospital with a space of 100 beds. I think we need to clarify the Tier 1 field with 100 beds. I believe it is a ward, Ian, not a Tier 1. Tier 1 is the facility that brings the operating theater, the lab services. What we'll be doing at Cornwall, we're close to concluding on this, is to essentially install a dome-type structure with all the support of airflow and otherwise for 100 beds at least. I understand it could be a little more than that. that will address the concerns of bed space, but the technical services will remain in the main buildings of Cornwall, and more will be said on that in terms of the efforts. That facility will be commissioned soon, and you'll hear more of that. I raised the issue of hospitals in this more extensive briefing on discussions of recovery to say that our hospitals are at a place where they can treat Jamaicans or non-Jamaicans who need service. They can treat Jamaicans who need emergency services, and we are indeed restoring the ongoing services of outpatient support at these facilities. We have been able to mount, with the commissioning of SAV, Lamar, 3 field hospitals. And, you know, the concerns have been raised as to how ready we were and how prepared we were. The truth is, in 3 weeks, is it 3 or 4 weeks now? 4 weeks, 3+ weeks, to mount an operation that has put in 3 field hospitals at the worst affected facilities with teams, with volunteers through bilateral or NGO arrangements, is an achievement. And I'm not claiming credit. I think the government as a team has done well to do the mobilization, working with our critical partners at PAHO, UNICEF, the respective countries and governments. And it is, you know, if you compare this response with other similar scenarios, Cat 5 type facility or even less, in other jurisdictions, some jurisdictions more developed than we are by virtue of economic profiling, Jamaica has done well. The health team have done well to get us to this point with the collaborators in the short space of time, of course, led by the Prime Minister and the Cabinet and the government. And I want to commend them and discourage those who would want to discourage them by citing the faults rather than citing the positives. And the ultimate positive is that Jamaicans can get care. And I've taken the time to make these points around hospital provisions and services because the real issue is whether or not Jamaicans can access service, and they can. So I crave Jamaica's understanding, and also hopefully this allows for some clarity for those who may seek to confuse the public in suggesting otherwise. We still have a lot more to do. We're still learning as we go along. There's no perfection here. This is not a perfect scenario. The storm probably is the most perfect of scenarios in terms of its wind impact and the destruction that it unleashed on us. But our response, I believe, has been commendable, and we continue to work to make it even better. So that's as far as hospital service is concerned. Now, in terms of Chinese government and people, we expect soon a Chinese hospital ship. The Chinese hospital ship, the Ark Silk Road, arrived in Jamaica's territorial waters on November 22nd and is now anchored at the Pedro Keys. It will relocate to the Falmouth Pier this weekend. A total of 104 medical professionals are on board, including 60 doctors, 32 nurses, pharmacists, and technicians. And that's another big boost to capacity of healthcare provision. I want to just recognize and thank the Chinese government for their support, and in this instance, a medical floating vessel with the personnel and equipment. The Office of the Chief Medical Officer is working with them and the team on the ground to find the best and most efficient approach to treating with patients, or certainly any other type of clinical support or otherwise logistic support that may be necessary as we seek to build back our facilities. So this is a first announcement, but it's a big boost, I believe, that will support our team in the field and further show the collaboration, the friendship, and certainly the preparation that would have been made and are being made to support Jamaicans in this difficult time. In terms of mental health, the mental health unit in the ministry technical support of the mental health and psychosocial support expert from PAHO continues to lead coordination and monitoring of the mental health and psychosocial support in communities. The unit conducts bi-weekly monitoring meetings with the service providers from different ministries, departments, agencies, and public and private sector to mitigate gaps in the delivery of mental health support services. Of note is that psychosocial support for healthcare workers in affected parishes is ongoing, and most recent intervention occurring on November 21. I believe Ian may comment a little more on that, but it is something that we take seriously, and it is one plank of our response. And we do believe that this is going to be more needed in the weeks and months to come as we seek to get the mindset of the people on the ground back into a space to restore some normality of thinking while the other issues are addressed. I want to just quickly turn to staff welfare, which is another plank of our response. Our ability to progress and succeed in our public health effort turns on our team members, and our staff have been resilient and have performed to the extent that they can, given the limitations. But they have also been victims, as said earlier. And so the Ministry of Health is giving the matter of staff welfare, including attention to our team's mental health, a major priority area as part of our restoration and recovery. We have begun a staff welfare initiative to assess the full impact of hurricane on team members in the health sector and to support their recovery. The initiative entails a number of support domains, namely, one, psychosocial, which will see an expansion of mental health awareness, the development of coping skills, and the deployment of trauma-informed care. So that's the first area, having done the assessment. Secondly, financial, where the ministry proposes to engage financial institutions, creating a pathway for affected staff members to financial resources to support recovery. Many have lost their personal possession, their roof, their cars, and other items. We're assessing that as part of how do we approach giving support. Now, support comes in many forms. It's not necessarily writing a check to say, buy back your house or re-roof your house. The Honorable Prime Minister has announced several measures. NHT, for example, we have already had a meeting with NHT to outline the profile of the staff that have been impacted and have gotten sufficient information from them to determine who may or may not qualify. But there are other agencies that we intend to have dialogue with as far as trying to assist staff to mount back a response to the devastation of the hurricane on their personal space or physical space. So psychosocial, financial, and the next is environmental, which concerns with the cleaning up activities, community support, and the rebuilding of infrastructure. Staff members have to clean up their homes too. They have to wipe down the walls, clear up the yards, and so on. And so we're assessing to what extent we can give support to them, again, to restore them to normality. So those three areas constitute what we classify as a staff welfare initiative that is now being managed. And I've asked the Minister of State, Crystal Lee, to help to drive that program, supported by the team that we have coordinating the response. So the process of effective delivery must, of course, be evidence-informed, and as such, the Ministry has developed a database called the Healthcare Workers Welfare Support Form. That's the Healthcare Workers Welfare Support Form, designed to collect preliminary information from the Human Resource Department across the ministry, its departments and agencies. The database collects demographic information of the affected staff, assesses the level of damage, and requests what the staff member requires assistance with, employ a person-centered approach to the ministry's efforts. So staff members can go on and input the concerns, the damages, and suggest what kind of and how the help should be formatted. The form was deployed on November 16th, As of yesterday, some 2,619 entries have been made, 2,033 for females, 5,086 for males. These are persons who have come online and filled out the forms expressing their areas of damage and concern. The majority of staff affected range from 26 to 33 years. It should be noted that 518 individuals were not collected, as communication remains a challenge across some of these areas. So given the access to communication channels, we are trying to address another approach to get that information. The Western Regional Health accounts for the majority of persons impacted by the hurricane, some 1,512, followed by Southern Region 579, and Northeast Region 328, and the Southeast Region 171. The Corporate Office and the National Council on Drug Abuse saw the least number of staff impacted, 15 and 14 respectively. So the affected staff span 54 facilities. Those are the highest count of affected staff are Cornwall Regional Hospital, St. Elizabeth Parish Health Department, Savlamar Hospital, St. James Parish Health Department, Noel Holmes Hospital, and Black River Hospital. We are therefore seeking on a separate stream to manage the information that comes in and to see how we can give appropriate attention to our healthcare workers. And this ranges from the consultant to the porter, right across the board. And this is important for us because our staff makes everything happen, and Jamaica depends on them. The patients depend on them. And so we're going to do what is necessary to ensure that they get appropriate attention. So I think the key to all of this is to say that we have a plan. We are working that plan. We are dealing with the emergencies in the first phase, getting hospitals back up, focusing on reaching people in communities that are inaccessible or difficult to reach, addressing the concerns that are health risk, environmental, water, food, seeing results in that regard, and ensuring that our staff members are back up similarly as they seek to do the work. Those efforts are going to continue. We are in phase one of a three-phase approach, which we will speak to maybe on another occasion. And this phase one for us is going fairly well. We're trying to account for everyone, patients and staff and facilities. And it is now, with time, we will see further updates in terms of the progress that we're making. I think at this point, Stephen, should I welcome Dr. Karen Webster-Carr on the epidemiology report? Thank you.
All right. Morning, everyone. So we're going to have three different presentations. Dr. Webster-Carr is going to give the epidemiological report, and I'm going to touch a little bit on service delivery update, and then Mr. Stein is going to give us an update on the mental health support. So I'm going to hand over to Dr. Webster-Carr. And also for the mental health support, Mrs. Paulette Spencer-Smith from the National Council of Drug Abuse will also provide a report. So I'm going to hand over to Dr. Webster-Carr, who will give the epidemiological report.
Thank you, CMO. Good morning, everyone. So in our epidemiological update, we're going to look at special conditions that we have been tracking over time. So the next slide would show the conditions that we will be looking at. So it will include leptospirosis, gastroenteritis, tetanus, and what the work we are doing in the shelters, part of our routine system and our enhanced surveillance system. So in summary, for leptospirosis, we have had some new results and we were able to confirm 11 more cases based on positive PCR results, and we were able to discard 7 cases previously classified as suspected based on a negative PCR result. So at this time, on the 26th of November, we would have 90 cases total for 2025, 51 pre-Melissa and 39 post-Melissa. Of the 90 for 2025, 21 were confirmed, 3 pre-Melissa and 18 post. We have had 14 leptospirosis-related deaths, 6 of which have been confirmed. 4 pre-Melissa and 10 post-Melissa, with 6 confirmed cases all being from post-Melissa. With respect to the next slide, we will look at over time the number of cases. So to get us into context or to tell us where we are Epi week 48. So that week is blank now. So 47 will be the lowest recent bar post-Melissa. So we have seen that increase that has happened post-Hurricane Melissa. Age and sex, from this slide, you will see most affected persons are persons 20 to 29 and those 60 years and over. The deaths are all males, and males predominate with the cases and deaths, particularly in persons 20 to 29, followed by persons 60 years and older. The parishes that are affected, St. James continue to have the greatest number of cases. And they followed by St. Anne and St. Elizabeth. The confirmed cases, 18 confirmed and 10 deaths. This is a spread of cases of leptospirosis post-hurricane, as would have been in the table prior. Cases prior, cases are concentrated in St. James, followed by St. Anne. So let us move to dengue. For dengue, we continue to be in low activity. And we believe this is true. Why? Up to today, we have gotten back 39 results of dengue, for dengue testing, all ranging from the 8th to the 18th of November. All of these were negative. So we are indeed low activity for dengue. With respect to respiratory infections, when we look at influenza-like illnesses over our 78 sentinel sites to get a feel of what is happening, for all ages, we were in normal range. That is, we are below alert and epidemic threshold. When we looked at hospital admissions for severe acute respiratory illnesses, we are in normal levels. So we are below alert and epidemic thresholds. So we could say that is for the national, but what happened parish by parish? All parishes are within normal range for acute respiratory infection in all age groups. For gastroenteritis, the two age groups, we have a similar picture. In all parishes, we are in normal range for gastroenteritis. For fever, what we call undifferentiated fever, we are in normal range for all age groups. Accidents, this is a little different. For under 5, Westmoreland and KC are in epidemic levels. For over 5, Westmoreland is in epidemic level and KC is in alert level. Note, the hurricane was week 44, so from hurricane week to the last week, ending on Saturday, Westmoreland has seen an increase to epidemic levels for injuries. And that causes a risk for tetanus, which we have to remind persons to get treated because they need to have vaccination if they have been injured. And we have seen that an increase in injuries and particularly nail injuries. Post-hurricane Melissa, we have had 2 reports of tetanus. One has been clinically diagnosed, a 71-year-old male from Westmoreland. This person died. The other person is under investigation. Both had nail stick injuries. And then let us look at the shelters. So this is from just pre-Melissa, and over the time, we have had very few cases of the conditions under surveillance. Particularly what we have been seeing is fever and cough. There are, however, a few cases of gastroenteritis, but as of yesterday morning at 7 a.m., there were no cases of these conditions in our shelter. And this has been so since earlier in November. So just to summarize what we have said, the status of this selected condition, we are seeing normal levels of respiratory infection, gastroenteritis, fever, dengue. For lepto, there are particular parishes that are involved, and for accidents, Westmoreland and KSA are seeing increased cases of accidents. Thank you very much.
Thank you, Dr. Webster-Carr. So we're going to move into the next presentation looking at the continuation of essential health services. And after listening to Dr. Webster-Carr's presentation, we certainly see why it is that it's important for us to return to services as soon as possible. We go to the slides. Okay, first I want to look at our primary care centers. And we're going to be mostly focusing on the 5 worst affected parishes. Just to say that in overall, we would have had 73% or 74 of the 101 health centers in these parishes return to their routine schedule of services. That means that when I say routine schedule, that means that if a clinic was supposed to happen, then persons, the healthcare professionals, are there on site for that clinic. And that may be that they're within their normal structure. It may be that they're in a tent structure, or it may be that they have driven out to the site to be there. But where there is supposed to be a clinic, then in 74 of our health centers of 101, or 73% of our health centers, we have routine schedule of services. In another 12% or 12 health centers, we have partial services, meaning that we are making the effort to be there on the scheduled days. But on some days, we may actually join the clinics. So if we had maternal and child health services where we had antenatal care on a Tuesday and then we had immunization on a Thursday, we may pull them together on one day and have that on a Wednesday. And for those services where we have joined up the services, we are providing an enhanced service, because where it is that we normally have maternal and child health services and a doctor would not normally be present to give acute or chronic care and the pharmacy would not normally be present, we're making the effort to bring out the doctor and the team, and the NHF team is with us as well to be able to provide those services. So in another 12% of our health centers, that is happening. We still have 15 health centers that are closed. And for these health centers, arrangements would have been made for the provision of services. If you look closely at the map that is on the screen, you will realize that for St. Elizabeth, we only have 3 health centers that are closed. 18 health centers are open. In Westmoreland, we have none of our health centers are closed. We have 2 health centers, and that is St. Leonard's and Beeston Spring, where it is that we have not had the clinic that is scheduled as yet for the month. So, but we have none of our health centers in Westmoreland are down. And Westmoreland being the hardest hit parish, the health team has really made an effort to open up the health centers and to be there for the population so that they can have access to service. In Hanover, you will notice that we also have 3 health centers that are closed, and we are hoping that for this week, we will be able to get Ramble, have some services in Ramble, so that would reduce us to 2 of the health centers. The 2 health centers that are closed are the very small health centers, which is Montpelier and Nyeri, and those persons, the community health aides, are out directing them to where it is that they should have service. St. James is one of the parishes that we're having most of the health centers that are closed. The parish has been affected by quite a bit of flooding, and for this map, you will see 9 health centers closed in St. James, and this was as of Friday last week. By the end of this week, we are hoping that another 3 of these centers will be up offering full or partial services. So we are making progress there in St. James, and I'm going to look closer at St. James in the next slide. But for Trelawney, I want you to notice that all health centers are offering routine schedules in Trelawney. So persons need to ensure that they're coming out to get their service. The next slide, look closer at St. James to show where it is that persons are to go for services. For Goodwill and Lottery Health Centers, persons are being seen at Adelphi, and we also have home visits being done for some services. I cannot see some of the health centers, but for some of the other for Salt Spring Health Centers, persons are to go to Glendevon and Mount Salem. And for Catherine Hall, persons are to go to Glendevon Health Center. For Roehampton, the building is down, and the CHAs are out doing dressings and redirecting persons to the nearest clinic. And for Catadupa, we expect that Catadupa will be up this week to be able to offer services. Partial services are being offered at Mount Carey and at Cambridge. For the next health district, some of those services the health centers are closed, but we have our CHAs, and the midwife is out in those clinics, because those clinics that are closed are pretty much maternal and child health services, and our midwife has been out in the field visiting the patients, and persons are being redirected to Maroon Town Health Center. So while it is that we have a few health centers here that are closed, we are working to open up more for this week, and we expect that this map will look different next week. But in addition to the health centers and the spaces that our services are normally provided in, I want to ensure the public that our health promotion and education teams are out. So they are visiting communities that are remote and providing information on how it is that you care for illnesses, how it is that you prevent illnesses, in particular leptospirosis and dengue. We also have teams that are out offering psychological first aid. So these are separate from what has been happening at the health center. We have our vector control teams also out in the community. We also have specific combined service outreaches to cut off and hard-hit communities, especially when we hear of a community that has been cut off and persons are not getting service. Then we make a special outreach to get to that area with many different services so that they can be served at one time. And we also have the shelter visits that are going on. The public health team routinely visit the shelters. And now the public health team is coming with the NHF bus. They're coming with the curative team, with the doctors and the nurses, so that they're able to see the patients there. And then we have the community health aides that are carrying out their regular home visits, redirecting the clients. They're doing dressings and they're doing the antenatal checks. So in this way, we're not just restoring our sites, fixed sites for normal service, but there's several groups of outreach teams that are out there in the communities trying to really form a net over the entire area that is affected. So just a quick look at secondary care. We know that Black River Hospital was affected and that a field hospital has been established there. Next slide. So at the Black River Hospital, Minister would have advised that we had 1,271 patients that were seen from November 6 to 25. They had 70 admissions, 2 cesarean sections, and 14 other major surgical procedures were done at the field hospital. While at Black River Hospital, we also have serviced there. 752 patients have been seen there since the hurricane. We've had 19 normal deliveries done at an area that has been set up close to between the health center and the hospital, and that's where deliveries are being done. And we have not resumed our outpatient clinics. However, the patients have been turning up on their clinic dates and they are being seen at the Black River Hospital. So this is just to ensure the persons in St. Elizabeth that there is service at this site. We are fortunate to have the field hospital as well as we have service also at the hospital. So persons must come in when it is they're having any problems. In Falmouth, in Trelawney, the same, in that we have the field hospital that has been established. This hospital had over 80% damage to the roof. And next slide. And we have services, some services have returned at the Falmouth Hospital. The capacity of the hospital structure has been reduced to 51 beds, but we've been having an average of 65% bed occupancy over the last week. The operating theatre laboratory services are down and they are supported by the field hospital, and outpatient clinics have not yet resumed as there's no space for that now. Next slide. At the field hospital, they are seeing an average of 30 patients daily there. Approximately 10 inpatients on a daily basis are there, and the field hospital is not only providing service to Falmouth Public General Hospital, but surgeries from Cornwall Regional Hospital that have been affected in terms of general surgery cases and obstetrics and gynecological cases are also being accommodated in the Falmouth Field Hospital. So at Cornwall Hospital, as we know, the roof of the temporary wards were severely damaged, I would say with 100% loss. Approximately 50% of bed capacity has been lost. And the damage would have resulted in a severe compromise of spaces, meaning that the accident and emergency department is overcrowded at this time, as there is a shortage of bed spaces to move patients to the wards, and of course the ward spaces are also overcrowded. And so the field hospital that is to come, that will offer additional bed space, will help to decompress the hospital so that persons can be better spaced. The operating theater facility at the hospital was affected. And so persons who are going to Cornwall will recognize that we are doing emergency surgeries. So if it is that there's an emergency, then there is an operating theater there that is serving that purpose. As I've noted, we are moving some patients to the field hospital at Falmouth for elective surgeries. And also, we have been able to transfer patients to the other hospitals in the country to get surgeries. So services are restored but not operating at full capacity, especially in terms of the ward space. But notably, the radiotherapy services are back up. The oncology services never stopped. Dialysis service had just a very brief pause and have been back up. And the outpatient clinics, very importantly, have restarted. At Noel Holmes Hospital, we also had some loss of roof there. And at the time of the disaster, we had about 30 patients that were in the facility. And we have remained with that bed occupancy up until now. Next. The tarpaulin coverings have been put in place, and there's some cleanup that is happening now. But since the hurricane, there has been a steady flow of persons seeking care at Noel Holmes. We've had a total of 27 deliveries that have been done since the hurricane, which is an increased number for this hospital, but they have been able to accommodate this. We've had 933 patients that have been seen in the emergency department and about 34 patients that are on beds in the hospital on a daily basis. 27 patients have been transferred out for further care, and this again is the testimony of the support that has been provided by the other hospitals in the country to these hospitals that are affected in this part of the island. The field hospital has been erected since the 24th of November. The emergency department services have now been relocated to the field hospital, so patients that are going to that facility will find that there's a little bit more space, and the health center patients are being able to be seen better because they are utilizing some of the space at the hospital now. Outpatient clinics have not formally returned. However, patients are showing up and they're not being turned back. They are being seen in the limited space that is there. At Savlamar Hospital, as we know, the outpatient department was demolished. We have put up 2 tents in order to help to see persons, but most of the patients that are being seen, they are showing up for their outpatient clinics, and they are being accommodated whether in the tent or on the wards. Inpatient services at Savlamar have been restored, but again, there is reduced bed capacity leading to overcrowding in the emergency department and on the wards. And with the new field hospital that is being set up, we also expect that we will see an improvement in this, as some of the patients will be able to be housed in the field hospital. We have 1 operating theater that is functional, and when the field hospital comes into service, it is going to provide support for the emergency department, for general surgery, and for orthopedics. Next. So just want to recognize that we have had tremendous support from the other regions, from Southeast Region, from Southern Regional, from Northeast Region, and also from the University Hospital that have facilitated transfers. They have facilitated elective surgeries being done. They have deployed their staff to provide relief in these areas, and they have provided outreaches for routine and specialized services in the communities, and they have also provided psychological support for the staff. So in addition to those services that are being provided on the ground in terms of the service delivery sites, I just want to, this is my last slide, just to say that in terms of the support that is being provided from the head office team, That has been tremendous. We have had increased number of field visits to the area to get a good understanding so that we can plan the response elements. We have had our heightened surveillance. We have had our EOC operations that have continued and that we monitor from head office what is happening in the parishes. We've been providing logistic supports for the movement of persons and the movement of supplies for the deployment of relief supplies. We have been providing support to our healthcare workers. We have been looking at how it is that we manage waste management, putting in other methods of dealing with this. We have done a tremendous amount of development of new educational materials and materials to be put out to the media so that persons can be informed. Our public health inspectors have been on the ground paying attention to food and water safety. We have been looking at nutrition in emergencies. And I just want to mention here in terms of supplements, especially to our women who are of childbearing age, those that are pregnant and those that are not, how important it is at this time to ensure that you visit your health centers or your private doctors. And for our doctors out there, whether in public or private sector, to be generous in supplying these women with supplements so that we can ensure that if they do become pregnant or those that are pregnant, that we can prevent some of the early problems that can occur during the pregnancy, because we did have problems after Hurricane Gilbert, where it is that we had pregnancies that happened, and because there was not adequate amount of iron and folic acid, that we had some developmental issues. And we want to ensure that this does not happen. And so our nutrition team will be doing more planning with the teams on the ground. But at this time, I would advise persons, healthcare workers, to be generous in terms of recommending supplements to women of childbearing age, and for women to take up this offer, and even to visit your pharmacies, etc., to be able to get supply of supplements, particularly of folate. We have also been looking at monitoring and support to our vulnerable groups, or HIV patients, TB patients, other groups that are vulnerable. The particular program areas have been reaching out to these groups to ensure that they're not left behind. We have been doing a lot of work in terms of the registration of our foreign medical teams, and we have had our enhanced antenatal outreaches. Rapid assessments of all the service delivery areas is being done, and we have looked at how it is that we have enhanced laboratory capacity to be able to provide testing for leptospirosis, dengue, and other possible infections that can occur. So I would end here just to provide that brief outline of what it is that we have been doing. And then I'm going to hand over to Mr. Stein, who is going to give us a report, and Mrs. Spencer Smith on the mental and psychosocial support.
Thank you very much, and good morning. Thank you, Minister Tufton and P.S. Green, and of course, Dr. Brissessa McKenzie, Chief Medical Officer of Health. I have to start, of course, on behalf of the Pan American Health Organization and the World Health Organization to again express our deepest solidarity with the people in Jamaica as we continue to recover from the devastating impact of Hurricane Melissa. So beyond the visible destruction of homes, schools, and infrastructure, we must recognize the invisible wounds, the emotional and psychological toll that such disasters unfortunately leave behind. So in these times, mental health and psychosocial support are not optional. They are essential. When individuals have lost loved ones, livelihoods, or a sense of safety, their emotional state is fragile. Our collective responsibility is to ensure that every person affected is met with compassion, dignity, and care. One of the most immediate and effective tools that the Pan American Health Organization recommends, as well as other organizations, is psychological first aid. This is not about clinical treatment. It's about listening with empathy, offering comfort, and helping people feel safe and supported in the aftermath of a crisis. Psychological first aid can be and is currently provided by trained community members, volunteers, and frontline responders. It is the first step. It is first aid in restoring hope and stability. At the same time, we must recognize, and we do acknowledge, that some individuals will require enhanced interventions. For those experiencing severe distress, persistent symptoms, or pre-existing mental health conditions, referral to specialized services is critical. This means working with the health system and its health professionals so they are equipped to provide counseling, psychiatric care, and long-term support when and where it is needed. I want to emphasize that this work is delicate. In providing first aid, persons are engaging with people at their most vulnerable moments. That is why the Ministry of Health and Wellness and MOHW recommends and strongly advocates adherence to quality standards in all mental health and psychosocial support activities. Every action, every interaction, every activity must be guided by respect, confidentiality, and sensitivity. As I noted, the first step is to provide support to people who need psychological first aid. In this context, I am able to report that above and beyond the existing capacity that was within Jamaica before, over 1,200 persons, non-health professionals, have been trained to provide psychological support or trained to train others. This support is both scalable and sustainable as it builds on the capacity to provide initial psychosocial support in the affected areas to vulnerable groups and frontline workers. Mindful of the urgent need to support specific psychological aspects of health workers, there's been a training of over 60 health personnel that has been completed for their specific deployment to address the needs of health workers. Knowing the critical attention necessary to support children, the future generation of Jamaica, there is enhanced coordination with the Guidance and Counseling Unit within the Ministry of Education to support training of principals, teachers, and guidance counselors. Colleagues, we know that the health messages pertaining to mental health are frequently amplified by the media, and that our colleagues from the media are on the front line reporting and interacting with the public. Therefore, there has been a targeted effort to train media personnel on psychological needs of the persons with which they are interacting. Aware of the urgent need to take meaningful action in communities, support has been provided to affected parishes for enhanced psychosocial support, offering increased face-to-face assistance to vulnerable individuals, frontline workers, medical personnel, and to communities in the affected areas. A wide range of partners, government, the leadership of the Ministry of Health and Wellness, NGOs, faith-based organizations, community leaders, and international allies are working tirelessly and who must all uphold the quality and ethical standards. The commitment that ensures affected persons are not only receiving assistance, but that this assistance is safe, ethical, and effective. Together, the government in Jamaica and its partners are building a response that goes beyond repairing physical damage. We are helping individuals and communities regain their sense of control, resilience, and dignity. Let us remember that recovery is not only about bricks and mortar. It's also about hearts and minds. By prioritizing mental health and psychosocial support, collectively, we are laying the foundation for a stronger and healthier Jamaica. Thank you.
Good morning, everyone. My name is Paulette Spencer-Smith, and I'm the Acting Executive Director for the National Council on Drug Abuse. The NCDA is now a department of the Ministry of Health and has in its expanded role not only substance abuse prevention and support, but also a wellness and psychosocial development of our population. Today, I'm going to be talking to you about a special project to be able to support the staff welfare for healthcare workers in the Ministry of Health. Our current state is that all healthcare workers are not back to normal. The region with the highest staff impact would be the Western Regional Health Authority, second highest being the Southern Regional Health Authority. The highest level of homelessness is in the Western region, communication systems remain poor. Most communities that staff belong to are without light or water. Workplaces in many times have unreliable support of power, but 80% of staff members are on the job. So when we look at where it is that there is impact, the numbers for the Western Regional Health Authority is 1,512. And we'll talk a little bit more about what that impact looks like. We can go to the next slide. When we talk through what damage looks like, a minor damage is reported as the home is still livable. Moderate damage is where perhaps a section of the home has that roof gone or broken doors and windows, and that there is some kind of hurricane debris that is around. Major damage is where all sections of the home have been impaired. And destroyed or homeless, the home is completely destroyed. So we want to be able to look at the next slide that now talks through where are we at. So overall, for all regions, we have most people most staff members indicating that they are having moderate damage. Minor damage is at 741. Major damage is 530, but we have 217 staff members that have been destroyed and are now homeless. When we break that down into the region, you will see that by region, of course, the Western region is supporting the greatest level of homelessness as well as the greatest level of major damage. When it is we ask staff what are the needs that they have prioritized these needs to be able to indicate that what it is that they need now is assistance with repairs to windows, doors, and roofs. And they go through to be able to identify that the next level of priority is assistance with clothing and furniture, assistance with replacement of damaged equipment, food and sanitary care packages, disability-related assistance, and assistance with medication. So that is the needs as identified and prioritized by staff. Our staff welfare plan is to reach the affected staff with welfare support that enhances their personal recovery from Hurricane Melissa and to support their efforts to provide quality health services. And we have the principle that we call CARE, which is connect, acknowledge, restore, and empower. In our connection, we want to be able to connect with staff members. We want them to know that there are teams of people that are concerned for them. We want to be able to acknowledge the trauma. We want to be able to restore them to support, and we want to be able to empower them with psychological skills to be able to support stress management. We have 4 domains that we are going to be working through. They are physical, psychological, financial, and environmental, and Minister in his presentation talked about that. Let's look at what are some of the activities that we can expect. Between week 0 and week 4, our efforts really have been around assessment of the needs and the data collection. We are looking to be able to make sure that we have a national, robust database as to what the needs of staff members are. And then we have moved to be able to identify how we can provide support packages, which may include PPE, tarpaulin for their homes, environmental cleanup groups, and some psychological first aid for them. There is a significant need for accommodation support with short-term rentals or lease agreements for staff members. Week 4 to 12, the concentration is really around coordination of financial benefit, how it is that we can connect them to what exists, and perhaps a negotiation for special loan arrangements that are going to be made to health care workers. For psychosocial support, we are going to engage psychologists contracted for their on-site support, support to be able to get document retrieval because many people would have lost some critical pieces of documents, and to be able to provide coping skills and stress management programs. For environmental support, the policy is seeking to be able to work through staff policy reviews to make sure that it is more in keeping to prevent staff burnout. We want to be able to advise the public to be patient with your healthcare workers at this time. They are people that are under significant strain, and we want you to be able to take all necessary precautions to remain healthy. If it is that you are in the business sector and would like to be able to support, please give us a call and let us know how it is you would like to help. Thank you very much.
Okay, thank you very much. There you have it. You've gotten a fairly comprehensive overview on the efforts by the ministry to respond and to build back and to provide services to our both internal stakeholders, staff, but also the patients that we serve. Thank you again for listening. It's been a little lengthy presentation, but we do believe it's necessary. And so we hand over now to Stephen to see if there are any questions or any clarity required.
Thank you very much, Minister. So I'm inviting our media colleagues on the Zoom to use the raised hand feature. If you want to pose a question to the panel, you may do so using the raised hand feature on Zoom, or if you want to pose your question in the chat to the members of the panel based on their presentation this morning. All right, so please use the raised hand feature, or you can pose it, you can type it in the chat on Zoom for our media colleagues, and we can respond accordingly. All right, Minister, we're not seeing any requests, so I'll just hand to you for your closing remarks.
All right. I think we have been very clear. Thank you very much for listening, and we will keep you informed. Thank you.
Do you recognize the signs of dengue? Look out for these symptoms: high fever, severe headaches,
I'll show them my way of justice.
I'm abused.
I need legal advice. I don't deserve this.
Truth of the matter is, justice there for all of we. The Ministry of Justice has trained more than 5,600 persons in restorative justice practices. More than 200,000 victims have been supported by the victim services. Legal aid reached thousands island-wide. Make we talk it out. Not